on a Monday. Thanks for clicking and joining us in our live conversation. And today it was Sunday, yesterday marks a big anniversary in the state of Oregon. It is the anniversary of our first COVID case testing positive here in the state. It was a janitor at a Lake Oswego elementary school. He is fully recovered now, but boy, he had a long 2 months on a ventilator, and we have his whole story in that amazing kind of story on KGW.com. Joining us this morning, Dr. Jennifer Vines, the health director for Multnomah County. Thank you so much for getting up early with us. Dr. Vines, a year ago, we had you right here where I'm sitting next to us in chairs in person on set, talking about this new virus called COVID, and we had this new case, and what did that mean for everyone? As we kind of take a live picture of this is what the Johnson warehouse. Yep. That's right. As that new vaccine is coming online now and ready to get distributed. So now we're working on 3 vaccines. Dr. Vines, it's been a year. How are you doing? How are you holding up? You're on TV and giving people updates, every single day.
Thank you for asking. I have, the tremendous support of my family and all of my colleagues who work in public health across the region and at the state. And I think there's a strong sense that this is by far one of the most important things we will do in our careers, if not our lifetimes. And the past year has just been extraordinary in so many ways.
So we're getting lots of questions from people on the stream and on our Facebook pages. I want to read one right now because they want to know, as people get vaccinated, like we all have friends or family, some are essential workers, some are in that upper age group, and they're starting to get vaccinated. So this person wants to know, does that change anything about how we interact with those people who've been vaccinated?
Great question.
It is a great question. I think we're waiting for enough people to get vaccinated to start to give more concrete advice. Certainly once you're 2 weeks out from a second dose of either the Pfizer or Moderna vaccine, or now 2 weeks out from a single dose of a Johnson & Johnson vaccine, you have very good personal protection. Studies are ongoing to see if you can still potentially transmit the virus, which is to say, could you have it in your nose and throat and potentially give it to someone who is unvaccinated? So masking and physical distancing are still with us, but as people get fully vaccinated and wait their 2 weeks, I think they have a level of personal protection that will allow for some safer gatherings here in the very near future.
But I just want to clarify, because I'm not exactly sure that I'm tracking all the way through. It does protect the person who's been vaccinated, but the people who are around that person, if they're also socially distanced and masked, when you say gatherings, is that still outside or is that inside?
I think we're still in the statewide framework for what are the recommended restrictions. So I believe we're still at 6 people total indoors, and indoors we know is the highest risk setting if someone is shedding the virus in their nose and throat. As we head into spring, outdoors is going to be a great option again for people to exercise, to potentially socialize with all that great fresh air and ability to spread out.
Maybe I'm jumping ahead to like what should be the 10th or 11th question, but I'm going to get there right now because you had me thinking. Dr. Vines, do you think there will be a day where we have this declaration that we beat COVID? Everyone, go back to living like you were in February of 2020. Will that day come at some point, or we're just going to kind of realize one day, oh, it's been a while since we worried about COVID?
I have a similar question that I've asked myself in the hopes of when do we celebrate, right, that COVID is over? I suspect what's probably going to happen is hopefully more people will get vaccinated, more people will be immune. We will stay one step ahead of the more contagious variants. And that over the calendar year 2021, my hope is that COVID begins to sort of fade into the background and we see cases become more rare. Certainly they won't drop to 0 and a lot of precautions will remain in place. But that's basically how I envision this year. And then whatever restrictions we peel off from that herd immunity, so to speak, that community level of protection, my hope is that will happen in the next several months. As with all things COVID, there are a million caveats about newer versions of the virus. questions about whether the vaccines will need to be adapted and we'll need to do another round of vaccines at some point. So again, I'm used to always inserting those caveats because it's been such a bumpy year. But I do hope that with these new vaccines and with people continuing precautions, that 2021 will be a good year.
So if people are getting, say someone has both of their shots, is there anything they can slack off on? Is there anything they can stop doing for them or people around them?
Probably the one benefit of someone who is fully vaccinated, who is 2 weeks out from their second dose, is if they have an exposure to the virus, if they have close contact with someone with the virus, the vaccinated person is actually not required to do the 14-day quarantine.
Okay.
So that is a new recommendation from the Centers for Disease Control. There are some limited exceptions, but that speaks to the level of protection of the vaccines.
But vaccinated people can still carry the virus. They may just not get sick or need to be hospitalized for it, right? But they can still give it to somebody else?
So the Moderna and Pfizer vaccines are very good at preventing symptomatic COVID-19. What we don't know yet is if they prevent the non-symptomatic form of COVID-19, which is to say you get a great immune response to 2 vaccine doses. There are still questions and some science yet to determine if someone can still carry the virus in their nose and throat as they fight off an infection and be potentially contagious during that window, which is why we still ask people who've been vaccinated to continue masking until this question is settled.
Well, a follow-up to Nina there. Do we have any idea, because everything is in hyperdrive as far as, researchers doing stuff that we never knew that they could do in a matter of months. But to answer your question, do we know when they may have the answer to that, whether people who are vaccinated can actually spread the virus to others?
I think those answers will start to emerge in the coming months, partly because the original trials that led to the approval of the vaccines are continuing, and also because with so many people now getting vaccinated, that opens the door to additional studies by scientists in different places to start to answer these questions and get us the answers about how well protected we are against the non-symptomatic forms of infection or against colonization, which is the term where you carry the virus with no symptoms and no sickness.
Dr. Vines, I have to assume that every day that you've worked over the past year, you've spent focused on COVID. Like there hasn't been any room for anything else. And yet there are still people, I'm just curious, because we hear it all the time in the news business from people who say this is overblown. I'm not wearing my mask. This thing is a joke. Things of that nature. I imagine, and it's frustrating on our end because we cover it every day, but I imagine from your perspective, it must be very challenging, must be very difficult to hear that and not get angry. But I'm just curious about, what you would say to someone if you met face to face with a person that says, hey, this thing we've been dealing with for the past year, we're overblowing it. I don't believe it. It's a joke. I mean, how do you respond to somebody like that?
I think people are smart. I think COVID-19 is it's been an incredible year, right? This virus that is just this tiny particle that we can't even see that's caused global disruption in our lives, taken almost 500,000 lives now in the United States. It is hard to believe. I think what I would say to that person is talk to a healthcare provider because they are the ones on the front lines seeing people struggle with this illness. Seeing people in intensive care units with this illness. And I would say, please, out of respect for them, reconsider and choose where you get your information wisely, because there's a lot riding on this for all of us right now.
What about herd immunity? Because, there are that population of people who, are anti-vaccine of any kind. And, kids make up nearly a quarter of our population. Mm-hmm. So that's 24% right there who can't get the vaccine because it has not been tested on them yet. And so how do we reach herd immunity? And it seems like it's going to take a while then.
Yeah, people pin the herd immunity threshold at somewhere between 70 to 80% protected. And ideally, that's protected through vaccination as opposed to protected through infection. You're right that there's no vaccine approved yet for children, although some are in the works, including the recently approved Johnson & Johnson vaccine. I think what we're really trying to do with vaccine is prevent severe illness and death. And so to have effective vaccines that all perform well on those measures is amazing. And I think by and large, kids have proven, there are exceptions, but kids have proven to be relatively mildly affected by this virus. So I think on the whole, protecting our elders, protecting those at highest risk of hospitalization and death is going to be a win as we wait for a potential vaccine for our kids. But knowing that by and large, kids rarely get the more severe forms of COVID-19.
How do the experts that put together the underlying health conditions kind of coalesce the types of things that pertain to COVID and the ones that may be chronic but don't?
I'm sorry, could you repeat the question?
The people who are actually putting together guidelines that say you have an underlying health condition and this puts you at higher risk for COVID. How do you come up with those guidelines? Because not every chronic condition will put you at risk for COVID.
Correct. Thank you. So the chronic conditions that contribute to severity and poor outcomes in a COVID-19 infection, we get those from studies of people who've actually been hospitalized with the virus. So those come to us from various Centers for Disease Control and other studies of people looking at who ends up in the intensive care unit, for example, and who fares better. So that is based on science. And you're right that not every chronic underlying condition has been found to contribute to poor outcomes from COVID-19. In some cases, that's from lack of information. In other cases, it's borne out by the data.
Dr. Vines, I'm curious because there's been a couple of hot button issues during the course of COVID over the last year. Right now, our top story every day seems to be centered around vaccinations. But before that, we were really focused on getting kids back in the classroom, and that's starting to happen now in different districts throughout the area. I just was curious about your opinion on that. Should we have moved faster in getting kids back in the classroom? Are you still concerned about getting kids back to that in-person learning? I was just curious your thoughts on that movement that's happening right now of kids going away from hybrid learning and getting into full in-person learning.
Sure. I think schools has been one of the most difficult issues in the span of COVID-19 response, and getting kids back in the classroom, I think, is a priority, especially for our youngest kids who we know need that social interaction to learn and who are also, like I said, at pretty low risk of severe COVID. I think teachers are rightly concerned about their potential risk. Any parent knows that kids are certainly good at trading viruses around the classroom, but I think it can be done. And I think we have the tools and kind of the blueprint for how to create safety in classroom, knowing that the risk is never going to be zero. So here in Multnomah County, we've been working and speaking with superintendents, trying to figure out how to build confidence that families and teachers need to feel comfortable getting back into the classroom, starting with our youngest kids who need that level of interaction the most.
How has this kind of changed? I mean, I used to go and interview you, down at the health department building downtown. We were in a little exam room. We did live Q&As. I remember talking about measles back when that was the big, outbreak and vaccine discussion. How has it changed for your medical colleagues and, regular doctor's offices? I had a doctor's checkup on Friday and you have to stand back farther, but it wasn't a virtual appointment, it was in person. But I mean, what's it like in the medical field? Are you guys, maybe better adapted to this than other kind of sectors and businesses?
I think that's a great question. I think in general, healthcare providers, they're much more familiar with infection control and personal protective equipment. And so, the masking and the eye protection and gloves and gown, none of that is new to them per se. Mm-hmm. I think they were right to be concerned for themselves as they go in and swab people's noses and do different procedures that potentially put them at risk. So there's been a lot of attention in the health systems, hospitals, and clinics on what is the level of personal protective equipment needed to keep our healthcare workers from getting infected. I think that the move to telehealth accelerated what felt like overnight, according to many of my colleagues. I think that is a potential win and something that could last into the future, just for convenience, good infection control in terms of maybe consulting with someone who you don't necessarily want to bring into your office. I think about measles and the importance of keeping people who are potentially contagious in some cases out of the clinic, but making sure they get the care they need.
I was at OHSU, and it's a teaching hospital, and they invariably always have two little students or residents like following around the doctor and taking notes, and maybe they'll meet with you first and then the doctor comes in, or they're at the computer typing up the notes while the doctor is talking to you. That seems to be done. So there's less people physically in a room and it's just the doctor. But I wonder if note taking is getting, harder and you don't have all those helpers kind of around, and if maybe that's, affecting medical students or something in some way.
Yeah, I don't know. I haven't heard that per se. What I have heard is just how difficult it is to spread out teams of healthcare workers who are used to working literally shoulder to shoulder, so that they could take care of their panel of patients, for example, and problem solve quickly. So I think it has been a strain on spaces for our healthcare providers, break rooms, nursing stations, where healthcare providers naturally tend to gather to share information and to provide good care. So I have heard that that's been a problem. I don't know if it's affected things like note taking and other efficiencies.
Yeah. So this is what I worry about. And maybe worry is the wrong word. I wonder about this. There are experts out there who say, oh no, this is not the biggest, baddest pandemic that is heading our way. This is just the warm-up act. So have we learned things with COVID that because we're so connected globally that we will carry on and move forward knowing better for the next time? And do you agree with those experts that there will be a next time at some point in the future?
I think there probably will be a next time. It's a question of when, not if. I think a COVID-19 virus that caused much more severe illness, like its cousins that I mentioned before, the Middle Eastern respiratory virus, the SARS coronavirus out of China back in 2003, those caused pretty severe illness, but weren't so contagious that they couldn't be contained through testing and contact tracing and symptom screening. So again, what's been so difficult with COVID-19 is just that people can have a very low grade infection and potentially be contagious. So imagine something as contagious as this virus, but causing more severe disease. That would be truly alarming. I think the lessons, the big lessons, I mean, there are many. I think we'll be talking about 2020 for a very long time. But a few of the lessons are being really agile in our ability to test for a new virus. The clear agility that we've shown around vaccine development, I think, is a win. But the last piece, and probably the biggest piece and most difficult, is that this virus has shed light on the fact that people are living outside. We have people in homeless shelters. We have Black, Indigenous, and people of color very disproportionately affected for structural reasons related to their jobs, their housing, their underlying health risks, and that generally we have some work to do in terms of improving our underlying health. So when you look at the risk factors for severe COVID, it's things like carrying extra weight on your body, diabetes, underlying lung conditions. We have some work to do in terms of improving our overall underlying health so that we're just stronger in the face of an infection like this.
Dr. Vines, I'll ask a yes or no question up front for this one. Number one, I assume the answer is yes. You personally know more about COVID today than you did a year ago when you joined us live in studio, correct?
Yes.
So now that you know more about COVID, and we know that, are you more concerned about this virus today than you were a year ago? Like a year ago, we didn't know, there was so much we didn't know, and there's that fear of the unknown. We know a little bit more today, at least, if not a whole lot more. But I'm just curious, now that you know even more, are you more concerned about it than you were before?
I think, with knowledge comes the ability to act. So in knowing more about the virus, we know now clearly that masking and physical distancing work. We know that ventilation indoors is really important, which is why outdoors is your best bet in terms of prevention. We have knowledge, not my knowledge, but the knowledge exists to create effective vaccines that look safe and really good at preventing severe hospitalizations and deaths from COVID. We have our partners in healthcare who have learned over the course of the year of how to treat this virus. And even though there's no silver bullet treatment, I think my colleagues in healthcare would say they're better prepared to manage severe COVID-19 infection when it does show up in the hospital. So all of those things together, I think, give me hope and optimism that we will get through this. But that's not to minimize the level of fear and uncertainty we had at this time last year, and the many bumps in the road, the many lives lost over the past 12 months.
What is the flu situation right now here locally? Because I remember, before flu season started, they're like, oh my gosh, this could be the worst thing ever, as flu kind of clashes with COVID and it could put more people in the hospital. But it seems like those masks, boy, it really keeps those germs close to you. How is the flu situation right now?
I can tell you, flu in the metro region is essentially non-existent.
That's amazing.
There have been extremely few flu cases this year. So we did a big push for vaccine, as you point out. We wanted to keep as many people out of the hospital from flu-related complications as we could heading into fall and winter, anticipating a potential surge in COVID-19. And it certainly appears that masking and physical distancing also work to prevent other types of respiratory infections. So that's no surprise, but again, another valuable learning from this last year.
Okay, you have already gotten your COVID shot, correct? I'm not sure how long ago, but you have one. Let us know what we're in for, because as the next month or two or three go on, all of us or many of us will be getting a shot. What kind of symptoms? How did you feel? Just give us a little bit of something about what we can expect as well.
Mm-hmm. So getting a COVID vaccine is like getting any other vaccine, except everyone is in COVID precautions. So everybody's masked, including the person getting vaccinated. It's just like any other shot in the arm. People will experience some soreness, some pain, swelling at the site of injection. Some people get some redness there. And then some people for a day or two after the vaccine feel a sort of achy. They may have muscle aches, body aches. Some people get fever. There's sort of a range of what we call side effects, but what are really anticipated effects. So these are signs that your body's immune system are actually responding to the vaccine. And these types of symptoms are more pronounced after the second dose. So I personally had a sore arm, a little bit of fatigue, sort of brain fog in the day or two after each of my doses, and that passed again within a day or two, and that's consistent with what the trials have shown us and with what others are reporting.
Brenda or Nina, do either of you have a burning question for the doctor before we let her go this morning?
I think she's pretty much covered it.
How about then, Dr. Vines, could you give us with one closing COVID thought as we enter what really is today the 13th month of living with this pandemic here in Oregon?
Yeah, I would say first, thanks for having me. It is a remarkable day. It's going to be a sunny day, so I would sign off with optimism that spring is coming. Keep wearing masks, gather outside, and remember that we are buying time now for vaccines, and we have 3 really good ones. So when you're eligible, take the vaccine that you can, and let's all hope that this year looks and feels very different than last year.
All right, there's that sunshine we talked about. If you want to show it one more time, Brian Matthews, our director. We can end with sunshine. Dr. Vines referencing the sun today. Dr. Vines, thank you for answering all of our questions. And thank you all for joining us here on Sunrise Extra.
Thank you.